Today looks like a busy day. We have a lot of patients.
Oh man. Let's get crackin'.
Okay, first of all, we need a registered nurse, ear, nose, and throat specialist, a licensed practical nurse, a doctor of medicine, and a physician's assistant. Send all of them to the operating room.
Okay. I sent out a page and they should be here any minute. Let's start with our first patient. The ambulance just brought in a 22-year-old male. Chief complaint, cardio problems. I want you to check his vital signs by using a stethoscope to listen to his chest to make sure everything is all right.
Okay, will do. I will give him heart medication. I told him to take the medication before meals. Also take the medication 2 times a day on Monday, 3 times a day on Tuesday, and 4 times a day on Wednesday. He knows to get the over-the-counter drugs at the pharmacy.
Make sure you get his date of birth, family history, social security number, and past medical history.
Already taken care of, doctor.
Very good. Thank you so much. I can always count on you. Maybe when we are done with all of our patients, we can go out for dinner and a movie, and maybe go back to my place for some alcoholic beverages.
That would be lovely.
This next patient is a 55-year-old female. She is in for a normal checkup. She is alert and oriented, and living in well. Her blood pressure is a little high, but she is on medication to help her with that. She has had blepharidema before, but that was because she had bad allergies. Her pulse is fine, and she has an outstanding range of motion. I would say she is well developed and well nourished.
That's what I like to hear. Oh my god. We have a trauma patient coming in. Head to the trauma room stat. This patient has a cranial fracture and stab wounds in the abdominal area and a gunshot wound in the right upper quadrant. Check the right lower, as well as the left lower and upper quadrants to make sure they don't have any wounds there. His urine has a straw color to it, which is good, so he is hydrated.
Okay, I will. One slight problem. He is unconscious and also not breathing. Start doing CPR and let's try to revive him.
Thank God we got a pulse. Give him some oxygen and keep a close eye on him.
Okay, who is next? 23-year-old female said she was having some problems in the vaginal area. She was complaining of menorrhagia and dysmenorrhea. She also has candidiasis. I would recommend doing a bimanual examination to find out the cause of this problem.
I also want to check her ovaries, menstrual cycle, vulva, fallopian tubes, and her rectum to make sure she doesn't have cervical cancer.
All right. Earlier in the day, we got a 19-year-old male come in with pain in his testicles. He said the pain was unbearable. I am in the middle of checking his scrotum, penis, and see if I can find anything. Can you help me out?
Sure, I will check to see if he has testicular torsion. The gonads are twisted and swollen. We are going to send him to get a simple operation. What they will do is make an incision and rearrange the gonad to the right location.
That must hurt a lot and he might have oligospermia, but he will get better.
Look at that woman over there. She is about to have her baby. From looking at the charts, her past medical history says that she has had 3 pregnancies, no abortions, and no preterms. Effacement is around 50%. She is about 7 centimeters dilated. Her expected delivery date was supposed to be in a couple weeks, but this baby is about to come out right now.
Should we help out or just sit here and watch?
We should help out, doctor. This isn't a time to joke around. I have an electronic fetal monitor on the mother's belly, and I have a stethoscope to listen to the baby's breathing. We have to make sure that the baby comes out the right way. There's a breech presentation, normal presentation, and a shoulder presentation. It should be a normal presentation, meaning the fetus head has to come out first. Sometimes if it is in one of the other positions, then there has to be a scheduled cesarean section.
The baby came out the right way and as healthy as can be. The dad got the chance to cut the umbilical cord. The baby was circumcised by the mother's request. Our next patient always lived life to the fullest. He had sex with everybody and did not use protection. One day he went to the doctor and found out he has every single sexually transmitted disease. This includes HIV, AIDS, hepatitis A, B, C, D, and he also has genital warts, syphilis, and gonorrhea.
Oh wow, that really sucks. I am going to send him to get a rapid plasma reagent test for syphilis.
Very good, thank you.
Here comes the ambulance. Looks like we have had this patient before. We have a 22-year-old female with cardiopulmonary problems. She has had a history of congestive heart failure, coronary artery disease, pancreatic cancer, and gastritis. She has dyspepsia, so we should make sure someone watches her while she eats.
Finish up with that patient. I have to take care of another one. 16-year-old male that is intoxicated. He had a total of 13 beers and he is throwing up everywhere.
I just got done with that other patient. I overheard you talking about this 16-year-old male and how he drank 13 beers.
Yes, sir. He is just like any other underage teenager. Always trying to be the hot shot. I want to send him to get a liver function test. Before the ambulance got there, he ended up falling down the stairs and hit his head and hurt his arm. Call to see if they have any openings to get a plain film. I also want him to get a computed axial tomography scan and an electrocardiogram. Also get a magnetic resonance imaging just to make sure there is nothing wrong with his head and thorax.
I am going to start him off with an intravenous to get some fluids in his system, as well as some oxygen.
Only a couple more patients left to go and then we are done for the day. Next patient is an 85-year-old male who fell and hit his head. He has some pain in his is an 80. He fell at approximately 4:30 this afternoon. He has been involved in INVA and has had bilateral hernia surgery. He goes to physical therapy almost every day of the week, which is his activities of daily living.
I would say to give him some aspirin to take away some of the pain. Since he hit his head, I want him to get an MRI.
I put him in the intensive care unit so they can keep a closer look on him since he is an older patient.
The patient in the room next to him is a 30-year-old female with respiratory problems. She frequently goes to an allergy and asthma specialist for checkups. She has sleep apnea and sinus infections. It is a little strange, but she also has a little bit of rhinorrhea. She told me that the reason she came in was because she had shortness of breath, an upper respiratory infection, respiratory distress syndrome, chronic obstructive pulmonary disease, chronic obstructive lung disease, and tuberculosis.
Okay, I will get in contact with a registered pulmonary function therapist so they can run some tests on her and give her the right treatment. They will probably give her a pulmonary function test and hook her up on some transtracheal oxygen. They have to make sure that her heartbeat is not tachycardia, that it is bradycardia. They already have an order for a continuous positive airway pressure machine that she can take home to help her with the sleep apnea.
Okay, this is our second to last patient of the day. We have a 21-year-old male with some chest pains and stomach pains. I want to check his vital signs before we get started. Make sure you do not forget to take his temperature. He has been suicidal before, so just keep an eye on him. He has attention deficit disorder and his brother has attention deficit hyperactivity disorder.
Okay, I spiked a bad so we can get some fluids in his system. I also hooked up a nasal tube so he can get a frequent flow of oxygen. At this moment, I am hooking him up to a 4-lead. I will put one on the right atrium, the left atrium, the right ventricle, and the left ventricle.
He seems to be doing all right, doctor.
Yes. He is going to make a full recovery.
Okay, our last patient is a 40-year-old female who is pregnant with breast cancer. She has good lactose and glucose levels. She has been getting chemotherapy on a regular basis, but I want to send her to get a mammogram. There is a possibility that sudden infant death syndrome can happen, but we are going to do the best we can to not let that happen. She is on her way to get an ultrasound just to be safe.
Okay, I also found out that she has been doing some prenatal tests, which leads me to believe that everything should go alright, but that also depends on if the mother is consuming a healthy diet and taking the right medications for herself and the baby. We are hoping that she doesn't experience preeclampsia, having premature contractions, a pseudocyesis, or hypertension.
Turns out she got the right treatment and both of them are going to be okay.
Wow, what a day. I'd say we both worked very hard today. You are a good nurse to work with. We should work together more often.
Yes, we should. We just have to make sure that we don't violate HIPAA by telling other patients' information.
You got that right, sister. Let's go grab some dinner. I'm starving.